Governor Kelly would like us to surrender to Obamacare, a broken and bloated system. Insurance costs have exploded since the enactment of the Affordable Care Act. I believe Medicaid needs reform, not expansion. We've moved away from the original purpose of Medicaid, which was to provide health coverage for low-income children, pregnant women, the disabled, and seniors. In Kansas, Medicaid is already struggling to provide those core obligations. We have long waiting lists in Kansas to cover services for the disabled and the elderly. Many of these individuals are in dire need of assistance, and adding more people, especially those able-bodied adults, will further exacerbate Medicaid's underlying problems. Not only is Medicaid fueling an entitlement crisis and bankrupting states across the nation, it is delivering substandard care to its enrollees. Research shows a long history of enrollees having limited access and worse outcomes than Americans who are privately insured. If match rates begin to fall, Kansas will have to pick up the increasingly larger share of expenses. If more people enroll in the system than anticipated, as has happened in other states, Kansans will once again face a budget crisis, which will lead to a tax increase to cover the rapidly rising costs of Medicaid. We cannot saddle taxpayers with this huge financial liability and another tax increase. We must work towards finding the proper solution to the soaring and unaffordable costs of health care. Expanding on a failed system that has become too expensive for most Americans is not the answer.